Welcome, everyone. I'm Dr. David Weber. I'm a pediatric endocrinologist at the Children's Hospital of Philadelphia. We're excited to be here today to answer your questions about Vamorolone, also known as Agamree, and its role in managing Duchenne muscular dystrophy.
Hi, I'm Dr. Annie Sprocki. I'm a pediatric endocrinologist at the Montreal Children's Hospital in Montreal, Quebec, Canada. David, we've received some excellent questions, so let's dive right in. What is Vamorolone and how does it work?
Vamorolone is a new steroid for the treatment of Duchenne muscular dystrophy. It was first approved by the FDA in October of 2023 for people with DMD who are 2 years and older. This applies to people living in the USA. If you live outside the USA, check with your healthcare provider to see if Vamorolone is available where you live.
That's right. Vamorolone is designed to retain the beneficial anti-inflammatory and muscle-stabilizing effects of traditional steroids, like prednisone and deflazacort, while potentially reducing some of their side effects. It works by modifying steroid receptor interactions, which may lead to fewer adverse effects on bone health, growth, and mood. What are the benefits and side effects of Vamorolone?
So Vamorolone has been studied for about 2.5 years in children with DMD. It shows similar benefits to prednisone and deflazacort in terms of muscle function tests, and it also allows the children to grow taller. However, like the classic steroids of prednisone and deflazacort, Vamorolone can still cause important side effects, including adrenal suppression and, in some cases, excessive weight gain.
Preliminary data suggests that spine fractures may be less common on Vamorolone, but more research is needed to fully understand its effects on bone health. Early reports indicate that mood and behavior-related side effects, such as aggression, may also be less frequent compared to prednisone and deflazacort. What should I consider before starting or switching to Vamorolone?
The decision to start or switch to Vamorolone is going to be different for every person with DMD. Here are some things to think about and to discuss with your healthcare provider. The starting dose of Vamorolone is usually 6 milligrams per kilogram per day, up to a maximum of 300 milligrams per day in the US. People with liver disease may require a lower dose, so be sure to ask your doctor about this. It's important to know that switching to Vamorolone may impact eligibility for clinical trials. And Vamorolone has not been studied extensively in teenagers, adults, or in people after gene therapy. So the potential risk and benefits for these people should be discussed with your doctor.
These factors should be reviewed carefully with your neuromuscular provider to determine if Vamorolone is the right choice for you or for your child. What is adrenal suppression, and is it applicable with Vamorolone?
Yes, this is a very important question. So Vamorolone, like other steroids, causes adrenal suppression. This occurs when long-term steroid use reduces the body's ability to make a steroid called cortisol, which leads to adrenal insufficiency.
People on high doses of steroids cannot make extra cortisol in response to stress, such as illness, surgery, or trauma, and require stress dose steroids to prevent a potentially life-threatening adrenal crisis. What should a stress dosing plan look like for someone taking Vamorolone? Can you use it as a stress dose steroid?
Everyone on Vamorolone needs a stress steroid plan that includes how to give extra doses of either hydrocortisone or prednisone during illness, after an injury, or before surgery. Importantly, Vamorolone cannot be used as a stress steroid because it blocks a hormone called aldosterone, which may lead to low sodium, high potassium, and low blood pressure.
Instructions for when to use stress steroids are the same for people taking Vamorolone or other steroids. Extra hydrocortisone must be given by mouth for moderate physiologic stress. Examples of moderate stress include a fever, illness that would keep a child from going to school or an adult from going to work, or a minor broken bone that does not break the skin. Severe physiologic stress is more serious and requires hydrocortisone to be given either by a shot into the muscle or through an intravenous. Examples of severe stress include persistent vomiting, a broken bone that breaks the skin, a car accident, or a medical procedure requiring general anesthesia.
What should my cardiologist know or monitor if I'm taking Vamorolone?
We don't yet know how vamorolone affects the heart, and that includes whether it has risks or benefits to heart function. Vamorolone may increase the risk of electrolyte imbalances like low sodium and high potassium, and this may be a higher chance of occurring when vamorolone is used with certain heart medications like ACE inhibitors, angiotensin receptor blockers, or mineralocorticoid receptor antagonists.
Your cardiologist should monitor electrolyte levels and adjust medications if needed. Regular heart function assessments, including echocardiograms and blood pressure monitoring, are also important.
Can I take Vamorolone if I also take a mineralocorticoid receptor antagonist like spironolactone or eplerenone?
Yes, we think this is okay, but should be done with caution. Since vamorolone blocks the aldosterone receptor, it may interact with other medicines used to treat the heart in people with DMD, like spironolactone or eplerenone, and it's possible this could increase the risk of those electrolyte imbalances in sodium and potassium.
If you're on both medications, your healthcare provider should closely monitor your potassium levels and blood pressure to prevent complications.
Okay, Annie, I think this wraps up our Q&A session. We appreciate all your great questions and hope this discussion helps clarify the role of vamorolone in treating DMD.
Thanks for joining us today. If you have more questions, don't hesitate to reach out to your healthcare provider. Stay informed and take care.